Hi, can you hear me?
Yeah.
Okay.
Monday, March 17th, 5 p.m. Dr. Illerhaus, consultant surgeon at ONZ Dublin, makes an important preparatory call before surgery. Patient Kate Baldwin will travel from Canada to Germany for a cervical spine surgery. Kate struggles with severe degenerative disc disease. As a result, Kate has suffered for years with pain and very limited neck mobility.
Even you can check it by yourself through a window. Turn your head and you are not possible to go over the shoulder, right? Of course, we want to give you the mobility back.
Wonderful, because yes, I do want to keep my ability to move, and I don't want the fusion, of course.
Dr. Illerhaus explains the procedure in the call. 4 artificial discs, one each between 2 vertebrae, will be implanted in Kate's cervical spine. The doctor must take as much time as possible for his patient before the operation.
So they, of course, nervous. What happens after surgery? What happens if there's a complication? I think there's a lot of questions, and we do our best to give them the support and the answers before they have the decision, or before they find the decision to come to Germany for surgical intervention.
All questions answered. Now it's time to get serious.
Yeah, we will rock that.
Arrival day. Cab driver Andy is waiting to welcome Kate at the airport. He is the first personal contact for ONZ patients here in Germany.
So I can calm them down if they're tense, because some patients are relaxed, but others are really nervous.
The ONZ patients never cease to amaze Andy.
When they arrive, some of them are sitting in a wheelchair, and 2 weeks later, they're able to walk again. And you can see the joy in their eyes.
Hello, nice to meet you. My name is Andy.
Hi, Andy.
Andy Ken.
Hi, Ken.
Nice to meet you.
Arrival in Germany with a lot of pain, but even more hope.
Oh, I hope everything changes. I hope I'm off the medication. I hope I'm feeling better. I constantly feel like I'm carrying like 20-pound bag of sand on my shoulders constantly. It's very tiring. So I look forward to that lift and feeling better.
For Kate, the real journey now begins. Leaving the airport, no point of return.
Regardless of what I'm feeling, it's going forward, and I'm just going in very positive. You go in positive, you get positive outcome. So,
as such, she is not traveling alone.
My brother came along with me here. This is my brother Ken, who I'm very grateful for to travel along with me and help me through this journey.
After a comfortable night in the hotel, Kate is accompanied by medical assistant Suzanne to the pre-op consultation with Dr. Illerhaus. Dr. Illerhaus explains the surgical procedure in detail for Kate. The opportunity to sit in this small doctor's office in Germany means a great deal to patients like Kate. Dr. Illerhaus sympathizes with their pain and their frustration.
I did not know it really personally, but I think it's a frustrating situation there in Canada. It's a long waiting time, even for a consultation with a spine doctor. And then if there's advice for a surgery, there's also have a long period to wait for surgical intervention.
Pain in itself is debilitating, right? And then you add on resources that are supposed to be able to help you. And when they say they can't, it just deflates you even more, right? So then you're looking for options elsewhere.
Suzanne, aka Angel Suzanne, accompanies Kate to the ward. Suzanne is the good soul of the house. Over a hot cup of coffee, the day before surgery, she takes time to answer Kate's questions. Today, she shares her memories of a former patient with Kate.
They come a long way. A long way means a long way of pain, a long way of suffering. They all have their little stories to tell. They are not in their home country. So I try to be here from 7 in the morning onwards, even if I just have to sit here and listen to problems.
I've never had any type of support like that, that of course isn't family, right? So I learned this morning that my surgery is a little bit more than what I thought it was. So a little bit concerned, anxious about that. But Suzanne has been fabulous, and I know that she's arm reach away.
I haven't been in that situation myself, having surgery far away from home, being on my own. I know what it means. I think like Kate would be able just to approach me wherever, whenever and wherever. It takes away the fear of what's coming next.
I'm expecting some rough days, but some rough days to some exceptional days in years to come. Well, there should be no fear about this journey at all. You're well taken care of. You're met right at the beginning, well, even before the beginning. So the surgery for me is going to hopefully give me my life back. I can't wait to get this 20-pound bag of sand off my shoulders because I feel like I'm carrying that around daily, and it's exhausting. You know what, when you deal with pain, it's debilitating. It affects every aspect of your life. My level of frustration, it is endless because there's no support. There's no one there. We have to travel out of country for situations like this. And it's not just myself. There's a level of frustration for many, many, many out there who are unaware of organizations like ONZ.
The optimistic mood among the doctors is a distraction for Kate. Shortly before the operation, she practices German again.
Dankeschön, bitteschön. And one bad word. Scheiße. Oh. Yes. Thanks, ladies.
For the team, 2 hours of maximum concentration will be necessary.
There are some steps during the surgery who are very complicated, especially in the level 3-4 and 4-5. We have to be very careful because the nerve root is very thin. So especially there we have to be focused.
Dr. Illerhaus now places 4 implants at the affected levels of the cervical spine. These implants restore the cervical vertebra height, allowing for full neck mobility right after the operation. From now on, absolute concentration.
Yeah, I'm nervous. I'm going to be super elated and relieved when I see her. I'm ambivalent because I'm very excited for her to get her life back.
Hey, Kate. Can you hear me? Okay.
So from my side, the surgery went well. We didn't have any complication. Surgery time was about 1 hour and 45 minutes. She had a severe spinal stenosis in all the 4 levels, but it was the goal to do the remobilization and to give her 2 implants, 2 artificial disc replacement, and that went very well. So I'm a little bit curious how she feels after surgery, but we will see how it is.
Surgery day might be fairly okay, but then a couple of rough days are coming.
But I do know 110% that it's going to be amazing.
Seven days later, and Kate has made significant progress, despite pain.
It's kind of hard. It kind of looks easy, but it's grabbing me in here.
Kate's final checkup is today at the Premium Rehab Center, Medicos auf Starker. Dr. Illerhaus is not alone. Dr. Bierstedt accompanies him. They consult with each other on all patients. So in the case of an emergency, there is always someone to step in.
Is the stiffness here? Is it painful if I press your muscles? Or is
It
more or
feels
less
good.
A final assessment under the critical eye of Medicos orthopedic director, Dr. Vieregger.
Can you swallow again, please?
Dr. Iller is talking about it, that the recruitment of the muscles is coming back, and this is a severe sign of a fast rehab.
With the 4 levels, I honestly didn't know what to expect. I think I was surprised even because I didn't have a good understanding of how intense this procedure was going to be until I had my preoperative with Dr. Illerhaus, and he shared that it was going to be a lot more than I had thought it was going to be.
I told you it's a hard way, and you will not like me the first day.
And you were right.
Yeah.
A look at the final x-ray shows how successful the operation has been. The 4 implants have been placed to perfectly align Kate's vertebrae. The x-ray shows how much space there is now between each disc. As a result, Kate is now 1 inch taller than before and will once again have full mobility of her neck.
Close to free. This is amazing. The first segment is free, and the surgical segments are also free. Yeah.
Moves well.
I see the light back in her eyes. She has her mobility, although she claims to be stiff. I can see that she's more independent.
Hi. I'm so tired. So tired. But yeah. But it's true. I am really passionate about ONZ, and yeah, hope that they can, well, what they do for me, they can do for many other people. It just flabbergasts me when I see my x-rays and I see how different my cervical spine looks. Like, I can hardly believe it's mine. I'm looking forward to some good sleep, because sleeping was very difficult, trying to find the pillow, proper pillow, and getting a good night's sleep, because you would often be waking up in pain. So I look forward to normalcy in the future of all the day-to-day activities that weren't normal before. It would be nice to have support of family and friends around again, right?
Family is everything. Health and family is 1 and 2.
Hey? Yeah. Did you listen? Yeah. Can you come over? Yeah.
It's pretty awesome to have had this experience and to share it with my brother. And I just appreciate what everybody's done.
Thank you. Love you.